Hello, everyone. Welcome to Inside the Operating Room. I'm very excited to have you tonight and have the company of my friend, colleague, countryman, Dr. Ian Bostock, a very prominent thoracic oncology surgeon. And we also have the pleasure of having uh, our great panel and a lot of group from inside the operating room work hard to bring you this nice conversation. We try to always invite someone who's pursuing a career in the specialty of the surgeon that we're interviewing. And this time we have Dr. Adrian Valderrama as a PGY in UCSF and interested in thoracic surgery. I think this is a way of connecting, the older generation, sorry, Dr. Bostock, to the young generation. So we're gonna start first of all by thanking everyone. This is our team, everyone that makes this possible. And this is always us together in all the important conferences. We always try to make time to be together, exchange ideas, and just say hi. So every time you have an opportunity where there's a LSS presence, please stop by. Everybody's more than welcome to share some nice food. Dr. Romero Arenas also has a good taste in picking the places that we meet. And as you know, we have this great mission to advance Latino surgeons in this country. We believe that this collaboration brings a lot of inspiration and brings a lot of strength in numbers for us Latino surgeons. So thank you for being here. Thank you to our founders, and you know them. They're working really hard all over to make sure that LSS gets involved in all the academic endeavors that we have and everything that it's possible to achieve a presence that I think the Latino surgeons require in building partnerships. These are our advisory group. You're going to find a lot of prominent names there. And I think you can use these names and these resources for your advancement and learning from these people. It's been, at least in my personal experience, it's been something fantastic that I've been able to access through the LSS committee. So this is our subspecialty groups and committees. Please feel free to email us, join us. There's always a need for people to be involved in these interest groups, and we have amazing leaders also in this group. So please feel free to reach out. We have a lot of programs, which includes this inside the operating room, the cafecito, soon seats, and pass the baton. So stay tuned. We had a lot of amazing personalities and people who have been very inspiring to learn about their journey in these different programs. And lastly, we have, as you know, all the benefits that I just described. So be sure that you connect with us. And we have a lot of opportunities, and we partner with journals, we partner with other institutions and members of different societies. So go ahead and do a little bit of research in our webpage. And thank you for all our members. I could just tell that every one of them are committed to the diversity part of bringing Latino surgeons and bringing that voice out. So we're very proud of showing their names here. Thank you again for your support and all the members. And just be aware of the conference that we'll be having. There's always an LMSA regional conference. We have our next conference with the Society of Asian and is it SAS, right? LSS and the Latino Society that is going to be in Huntington Beach, sorry for the typo, in the American College of Surgeons. And again, today we welcome Dr. Bostock. I hope you read about him in our banners, and we have him now in person. So we're very excited. Please follow us in these platforms. We're always trying to hear from you, exchange some ideas. And with no further ado, I'd like to welcome Dr. Bostock, and thank you for being with us. I hope I stop sharing and that we can go ahead and start having a nice conversation. Andrea, we're good. We stop sharing. We're good from the production standpoint. So Dr. Bostock, welcome. Thank you for being with us, and thank you for taking time from your busy life to spend time with us. And it's a pleasure seeing you on the screen. I haven't seen you in person in a while, but it's a pleasure seeing you.
Thank you. Thanks for having me. It's exciting to talk to you all tonight.
Thank you, Dr. Bostock. So, well, let's start with some questions. I think a lot of people they come to this platform, they have questions for our guest, and I think I like to start from the beginning. And it's something that your background. We read in your bio that you were born and raised in Mexico, in Mexico City, and can you tell us a little bit about why surgery? How was your journey? And what ultimately brought you to thoracic surgery and mostly specializing in oncology, thoracic oncology. So tell us a little bit about yourself.
Yeah. So, as you were saying, I grew up in Mexico City. That's where I went to med school, and I did an MD and a master's in science as part of my medical degree and my training there. And when I was entering the master's in science part of my training, I started working at the National Institute of Health in Mexico City, and I got this exposure to research and innovation and kind of like forward thinking, and that really got me motivated to seek a training elsewhere. Initially, I was kind of pondering where to go, and I eventually decided to apply for residency in the United States. And as many of us that come from kind of non-traditional backgrounds in surgery and into this country, I was told 1,000 times, it's not possible, you shouldn't come here, it's super difficult, you're not going to make it. But I worked really hard into getting all that the testing and the preparation and all the things one needs to do to make that leap. And then eventually applied to come to the U.S. for training, and I did an intern year at Brigham and Women's Hospital. I was there for a year in Boston, and that was an awesome experience. But I reapplied after my prelim year, and I eventually matched as a categorical resident at Dartmouth, just like you. And and I was there for my general surgery training. Honestly, before I started at Dartmouth, I had zero exposure to cardiothoracic surgery. I thought when I was entering general surgery that I was going to be a transplant surgeon. That's what was my research initially when I was doing my master's, and I just had an interest in that, mostly probably from exposure, but I thought that's what I wanted to do, and then I quickly realized that that lifestyle wasn't for me, and I started kind of becoming interested in surgical oncology and minimally invasive surgery, and as I saw more of it, I kind of fell in love with thoracic because I feel like the there's a lot of redundancy, or sorry, there's a lot of kind of it, union of those specialties, both surgical oncology and MIS in thoracic, and so that's how I eventually ended up deciding. And I also had really strong mentorship in it, which I think is crucial. I had a particular mentor at Dartmouth that really took me under his wing and kind of helped me along, and really kind of helped me fall in love with the specialty. After doing my general surgery at Dartmouth, I eventually moved on to do my fellowship with a specific focus in thoracic surgery at MD Anderson Cancer Center in Houston, which was kind of a life-changing experience. I loved my training there, and I thought it was top-notch. I really got exposure um, to just a bunch of really passionate individuals, and that gave me great training. I was there for 2 years, and then I moved on to Charleston, South Carolina for my first job, where I was for 3 years as an assistant professor at the Medical University of South Carolina, mostly working, as you said, with lung cancer and esophageal cancer and all other kind of like general thoracic surgery procedures as well. But my interest is in oncology, given my training and my background. But I do everything else as well. And then this past year, I relocated to now working at the Miami Cancer Institute in Miami, and this has been a bit of a whirlwind to switch jobs and to experience this like rebuilding what I was doing before. But so far, I've had a great experience here.
Hey, I'm Adrian. I just had a question about, I think you mentioned you had a really good mentor who was a cardiothoracic surgeon. I'm kind of in that place now where I'm looking for good mentors, and I'm curious if you could talk a little bit more about your advice for finding mentors and, kind of what does a good mentor, like what did they do for you, and what should we be looking for?
Yeah, that's a great question. I think there's a different ways I would answer that. Honestly, a good mentor, you don't have to have a single mentor to help you for everything in life. I think understanding that each person you run into can mentor you in a different way, and help you develop yourself in different ways. So instead of looking for that one person that's going to really change your trajectory, look for a group of people that are going to be on your team. And I think that's kind of what has happened to me. Each different person along my training and what I've and my career has really helped me in different ways. And then you're looking for more than a mentor. You're looking for a sponsor, somebody that really is going to support you and help you move forward. So I mean, I mentioned the person that kind of showed me thoracic surgery was Dr. David Finley at Dartmouth. He's the chief of thoracic there, who was just starting when I was an intern or a second year, I think, and I just got to experience a lot of cases with him. It was just kind of coincidence that I just got to see a lot of it, and I fell in love with the specialty. And it was then that I showed a lot of interest in what he was doing, and people like having um, interested humans come up to them and ask them questions and feel engaged. And I think just showing interest in what someone else is doing goes a long way. So that's how I found that initial mentor. But through my career, I've had many mentors that have helped me in different things: research, emotional intelligence, networking, career progression. Like there's all these different people that I've run into that have helped me in different ways, not just this one person.
Thanks. It's helpful
That's
to
wonderful,
hear
Dr.
how you think
Bostock.
about it.
Yeah, and we were just mentioning one of our one of the our people who supports us and gets us through this are not only mentors, right? A mentor guides your growth, but sponsors influences you. That's what thank you, Ale Silva, part of our team, who says that. And Dr. Bostock, one of the things that especially trainees have a feeling about thoracic surgery is that it's a very challenging ruling, and at times can be sort of malignant, if you want to say. Like, probably all the surgery specialties have their own stigma, right? Which doesn't mean that that's true. Every person, every institution, and every place is different, I understand, and the culture, I hope so, and we're hoping to contribute, is changing. What was your most difficult what's the most difficult part of your training, or what's the most challenging part in this journey for
I think, I mean, I honestly was very lucky to have trained in institutions where there was not an issue with a toxic environment. So when people meet me, I tend to be very kind of nice and amenable, and not what people would expect from a cardiothoracic surgeon. So, so they're like, "What happened to you? Where did you train?" So I didn't have that negative experience at all. But certainly that's something that happens in other institutions, and people talk about it for sure. So I'm not trying to sugarcoat it at all. It's a tough specialty, and what we do is high stress, very demanding. So there's certainly that component to things. But I think one of the hardest parts of getting through training is that this like immense learning curve that you get exposed to when you. I remember finishing as a general surgery chief resident and feeling like that like I was a good surgeon. I knew what I was doing, and I was able to take care of patients well. And then I started fellowship, and then it made me question that completely. And I'm like, what am I doing here? Why am I so terrible at doing this? And like, why did I make these decisions? So I remember at the beginning, it's just these incredible feeling of being uncomfortable and scared with how acute things are and how difficult the procedures are. But that is just an initial shock that once you start getting the reps in and getting used to and breaking down procedures and the science and what you need to know just a little bit more granularly, and you get more comfortable with it, that goes away. But at the beginning, I was very intimidated, and I think that getting those first few months under my belt was very challenging. Everybody suffers a little bit from that imposter syndrome, and I was very lucky to train at a really great institution, which only made me feel that imposter syndrome even more. and be more intimidated.
And people ask this question a lot. It has to do with fellowship and residency, where you always feel out of place at the beginning. You just have this feeling of hopelessness, right? That what am I doing here? This is just my path. And one of our one of our chats, one of the questions that Paul Anderson asked is, what are the things that you taught in a program while applying for residency or fellowship? What are the things that, with your experience, you will be able to sort out and look into that made you decide for these programs?
So when I was interviewing for fellowship, I made a list of all the places that made sense for me just from the get-go, like geographically, or the type of experience I was looking for, like an exposure to a major cancer center, or the type of procedures that I wanted to do. So for me, for instance, there was things that I was looking for that were like make or break. Like I wanted a strong cancer exposure. I wanted to be able to graduate with a good level of expertise towards esophageal surgery, which in thoracic surgery is tricky because not every place handles esophageal cancer the same way. In some places, it's a surgery that you share with surgical oncology, or something that you may not have so much exposure to. It just depends on the training programs. And some training programs in thoracic are have more exposure towards lung transplant or other types of clinical foci. So for me, oncology was important and esophageal surgery was important. And then I was looking for places that had two-year fellowships, because I didn't want to train for 3 years. So that narrowed the list for me. But also I wanted a place where if I spoke to the people there, they would speak about having a non-toxic culture, a place where people felt supported, where there was a sense of wellness or balance. Even though I was expecting things to be very high stress and competitive and difficult, I was still looking for that because that's how my training was. When I trained at Dartmouth, there was a huge component of that training program was focused on physician wellness, on being okay with your family, and being a dad and having kids and being all that part of who you are and what you bring to the table. So I wanted to carry that forward into my training and fellowship. So those were just things that I would bring in my mind into these fellowship interviews. And as I was mentioning, I was intimidated by the process, but I also felt a little out of place. So I ended up interviewing or applying to many, many programs, just because I thought I needed to be really safe. So I interviewed like at 28 different programs. So I think I got a good sense of what's out there. And I made a list based on these things I'm describing.
On the note of applying to fellowship, I think cardiothoracic fellowship has gotten really competitive, and a lot of people talk about research. Do you have any advice for kind of getting involved with research earlier, or what kinds of things that maybe residents interested in CT surgery should be doing in terms of research?
Yeah, I mean, I think you can't go wrong with having exposure to research. That being said, not everybody has the luxury to be able to take 2 or 3 years off to go into the lab and have a very productive research experience. I think something that I like, even when I was going through the process of in my previous job, we had an I6 program, which I was like, we were part of the selection committee as faculty and whatever. Something that's equally important to the research exposure is showing resilience, grit, and commitment through your training. So there's many different ways to get that to shine through, right? There's not only your published manuscripts, but your story, what brought you there, what would make you a valuable member of the team or the specialty. So I think it's in the way you tell your story, more than just focusing on the number of publications. I think being able to tell a compelling story as to why you should be a cardiothoracic surgeon or whatever you choose to become is very important. But yeah, so from my standpoint, like I did research through my training, and I did have a good number of publications. I had a competitive CV when I was applying, but I never took dedicated research time, and many of my colleagues did. So I think you can do both. And then I also know a bunch of people that just went straight through and had a different story to tell, and they still matched and they still did well. So I think you can do both things. That being said, thoracic tracks specifically, more than cardiac tracks, are super competitive. And if you want to train at a big cancer center or a very kind of thoracic oncology heavy program, there's like 10 programs in the country. So it is very competitive.
Yeah, that's an important thing to notice. And I think, as you described, Dr. Bostock, the learning about what's out there in your specialty, and for the people who haven't entered general surgery, also that's what's out there. There are different, we all meet requirements when we graduate, but there are different types of programs, right? Their programs are more heavy in the trauma. Like you and I never overlap as residents, but we kind of did. And during my time, thoracic was a big one also in a different way. But there was a heavy trauma when I went to Surgeon. I felt that it was a different thing, and like that helped me find my mentors, as you said. So I have a question for you that is important now that you moved to Miami, which feels that you moved closer to Latin America. What was the decision to move there? And when you're looking for a job as a resident or as an attending, what were the things that you were looking at? What were the things about your job moving in Miami, and how that's helping you maintain your ties to Latin America, to Mexico?
Yeah, it was a tricky decision because my job at MUSC, where I was before at the Medical University of South Carolina, I was really happy there. From a professional standpoint, I was super satisfied. Loved my partners; they were great, supportive. I got to do a ton of surgeries, the surgeries that I wanted to do. So it all sounded really good. And Charleston is a lovely city, so none of that was a problem. But when one thing that's true is that when I was interviewing for jobs, it was like right out of COVID. So I only had a few options. And I also had I was here on an exchange visitor's visa. So I needed to find a place that would support my transition to a more permanent immigration status here, which is tricky to do. So all of that was, I say, because finding a place that met the criteria for me was tricky. So kind of like destiny led me to Charleston, but it was as many of us that go through the process of applying to residency, being from a foreign country and going through all this process, even though I loved all the places that I've worked at. So don't get me wrong, I'm appreciative and thankful, but you don't get to choose where you go many times. It just happens to be that's the opportunity that was given to you, and you make the best of it. So even though I was super happy in Charleston, it felt like a place that for us as a family, like my wife, my kids, there was just not a lot of us in the place. We didn't feel there was very few Latinos. Probably we were the only ones. We never met a single other couple that was Latino in our community, which was kind of isolating and felt made us feel a little out of place. And then we started thinking about long-term choices, right? Like my daughter's 8, my son is 5. My daughter's starting to enter an age in which she's building friends group and what's gonna make her the person that she'll become. And we thought maybe being in a community that was more like us would be better. So as we were thinking these things, I got a call from this job at the Miami Cancer Institute, which I was not expecting, and then it kind of threw us for a loop. And once I started looking into it, it made a lot of sense for us from a personal standpoint, and for our life moving forward. But that being said, one thing that really struck me when I started working here is that, if I ran into maybe top 3 Latino surgeons in my entire training through the Northeast, through Texas, I can't even count them in one hand. And here, everyone is a Latino surgeon. So it's just so refreshing. I feel very included, and I feel just like, part of the community, which is really nice. I never experienced that practicing in other states in my training here. So, and then most of my patients are Latino, which is a new experience for me as well. So I didn't practice medicine in Mexico. So all of my experience has been here in the U.S. And very few patients were Latino, even in Texas, even even less so in Vermont and Boston and New Hampshire. So that's been a really gratifying experience.
I think you bring up an important point, and that's something that for the trainees, for the students, it's you're a whole, you're a person, and that's something that is brought up in the wellness parts of training, and it is for you, the balance with your family and having a place where you felt included, not that you're happy, like I said, I was happy, but at some point, that your training is going to lead you to live the life which you were training for. Does that make sense? Like you want to train to get certain things from, the economic standpoint, from finances, from comfort to bring your family or yourself or whatever are your priorities. And I think you touch a very important point for the younger generation is about how that balance sometimes finds itself, but you have to actively recognize it when an opportunity sets. So thank you for sharing that, Dr. Bostock. That's a very insightful.
Kind of on a similar note, I was wondering, can you talk a little bit about the balance in maybe in your life as a thoracic surgeon, but maybe more broadly in the field? And you touched on having a family. Kind of how do you balance that with being a full-time surgeon, and kind of what are your hobbies outside of work?
Yeah. Honestly, that's been like an evolving question. Through my training, I will say that I probably had no balance, zero. So like if I think back on like general surgery residency, I was very, very committed to making sure that I excelled during residency. For the reasons I mentioned, being a foreigner, trying to enter the workforce here, all that builds a lot of need to impress and and do a good job and to excel. So I was super focused on that. Probably didn't take care of myself or my body or my sleep in any which way during training. During fellowship, as I was approaching my 30s, I kind of started to feel um, that I was just not able to like do call quite as well, or that I had gained a lot of weight and not taking care of myself. So it only started until like maybe my second year of fellowship that I was like, okay, I can't eat pizza and burgers and not work out every day. So I started kind of thinking about that a little bit more and be more balanced and in how I took care of myself. But it was only until I became an attending that I really kind of felt like I was able to achieve more of a work-life balance. The same story goes for my personal life. During my residency, I did not do a great job. I mean, I tried my best to be a good husband, and my daughter, both my kids were born during my general surgery residency, but I don't know if I was a very present or well-balanced human during that time. But I mean, I tried, but looking back, I guess I could have done more. But I was really focused on trying to get us through that hurdle that is training. But now, the good thing about being a thoracic surgeon with the focus in oncology is that my life is very much, I mean, I take call and all that, but my life is very scheduled. So it makes it very easy for me to have somewhat of some control into the activities I engage in and how I do that. So I'm able to schedule, I know that I have 2 days a week where I'm going to be in the OR most of the day, and those are days where like mentally I'm prepared for that. And then my clinic days are usually the most taxing on myself. Like the emotionally clinic days are more difficult for me. But I know that that most days I get home at a reasonable time. I cook dinner. I give my kids baths. I help with homework. I'm like there, which gives me a lot of satisfaction in my life. And then in terms of like physical wellness, I've been able to integrate, working out at home, which worked better for me in the mornings before the day starts and the chaos starts, and all that helps me feel like I'm a balanced human being in this juggling act. But it's only until recently, honestly. I don't think I was very balanced before.
That's great because you mentioned something, and I think in a surgeon's career there are different phases, and I don't think I know your family, I know your wife, and they love you and they support you all the way. And I believe that we all go through phases as surgeons, right? Different phases. It's almost like blocks that you have to put, kind of finish it and move along. And so, other than your balance with your life and everything, this is a tough question that we try to ask everyone. If you were to give advice to you even younger self, what would you what would you what would you say? What would you tell yourself? Like, maybe do this a little different, or maybe let go of this or work this. What would be a good advice as a person and as a surgeon?
Man, it's kind of a weird thing to say, but I would advise myself to not take things so seriously, because sometimes you're so focused or obsessed about certain things that in the grand scheme of things are not going to really matter. There's things that matter and things that don't. And I don't know, maybe I would try to help my younger self to know the difference, even though sometimes I struggle today. But like there's certainly things that I thought were like so crucial that it gave me a lot of stress, and in the grand scheme of things, they didn't really matter.
And as a surgeon, what would you say? I know this is applies to both, and we understand, like, probably getting a stress or correcting that potassium right away was not the best way to
Yeah.
use your energy, right? But it's important, of
But
course, and you have to
I,
do
I,
it,
th- I
but don't
think
stress over it.
as an attending, I think is really important. Using that word energy brings to mind a really. So when I was during my first year of practice, I was really having a lot of issues with anxiety and kind of managing either surgical complications or in general just like the stress of dealing with these hard cases. And then I ended up kind of seeking just therapy and help just to cope with that first 2 years of practice. So I started doing some like cognitive therapy and these kinds of things, just like breathing exercises and other techniques, and really kind of helping developing a sense of when your body doesn't feel right is very important as a surgeon, because it'll help you understand when you're dealing with a lot of stress and when you need to start kicking in those mechanisms to help you, like either deep breathing or calming the tone of your voice or protecting your energy and the way you interact with people so you're not lashing out and throwing instruments and causing a ruckus, which is no one likes that. But I think knowing that about yourself and learning how to deal with that is really important. And so yeah, I think that's important to understand about how these stressful professions, you need to learn how to manage your emotions really well.
It's really helpful to hear kind of how you deal with managing your emotions. I think, as an early trainee, that's something that I'm definitely trying to be mindful about. I'm curious, do you work with residents at all now, or maybe when you did as a fellow, do you have a way you describe your teaching style?
Yeah, so yeah, I've worked with residents all through my training, and then as a fellow, we had uh, during fellowship we had PGY4s and interns and all and you name it. And when I started my first job, we had an I6 training program, no fellows, but I6, and that was a whole new learning experience. Teaching thoracic surgery to a younger resident is a whole can of worms. So like I would sometimes have to do esophagectomies with a PGY3, or like do like a complex lobectomy with a PGY2, and you're like, don't touch that, that bleeds, so yeah, you just have to manage different trainees in different stages of their career. So my style has always been about kind of meeting the trainee where they're at, and then kind of trying to find a way to progress from what I see. And you can tell really quickly kind of like what level of skill they're at, what point of their training they're in, and then not necessarily by PGY level, but most of just like what they can get away with. Um, so, for instance, robotically, I tend to be very systematic, and I want to see certain moves that, to me, say that they're safe, that the dissection technique is up to par, and what they're doing is going to lead to good outcomes. So, if even if they're a PGY4, if that's not happening, they may not progress. But I'll say that most of my PGY4s were getting through, a lobectomy skin to skin with me by the end of their training, which was super gratifying to see. But it just takes a lot of, feedback and understanding how to make someone better. And some people need different types of feedback. Some people, in my experience, some of my residents needed for me to be tough on them, and some of them needed TLC. So it just depends.
Yeah, that's something that I think everyone as a younger attending will struggle. So all of you who are listening, following a residency, you're gonna struggle with that, because especially if you're involved in education, you want to follow that line of safety, but also allowing people to grow in their own skin. And I think Dr. Bostock, you touch a lot about, and I want to reflect a little bit more on that. Uh, Mental preparedness for cases, how to prepare yourself, how to wisely invest your energy how to recognize symptoms of anxiety or maybe depression, or maybe just not feeling yourself right. And that's something that it's a very proactive, I would say, approach, right? The same way you would approach a case, right, or an emergency, or a leak, or whatever you do in the operating room, right? You have to approach your mental health, and you have to approach your ability to cope with that in the same fashion, right? You have to be aware, you have to recognize that, you have to study, you have to like quickly try to manage it. And I think I really enjoyed that part that you said about your energy. What else do you have to say about that? How did you learn to, you say you use cognitive therapy, some breathing exercises, but you continue to do that? Is that something that's become
Oh
part of
yeah,
your routine?
yeah, yeah. So I mean, a lot of things that I did during even for my fellowship. Like if you're doing a super difficult case, or like not in my fellowship, but more in today. If I'm gonna do something very technically challenged, so like I'll make a scenario up where I'm like taking a chest wall, a mediastinal mass that I need to peel off the vena cava, and I potentially need to go on pump, and it becomes this super problematic dissection, and every single step is stressful. So things I do to work through a case like that, we talk about deep breathing exercises. The thing that helps me is I kind of like take the tone of the room down. So like my voice is always really calm, really low, no screaming, nothing. And that kind of like makes everybody feel calm around me, which is important because you got to be in control of the room as a surgeon. So the way I talk to people is very kind of it's very intentional, I am trying to keep a smooth pace. I talked about the deep breathing. I talked about, and then one thing I didn't talk about is visualization techniques from beforehand. So I think about the procedure the night before and the morning off, and before I have like the steps in my mind. But it's more than just naming the steps. It's kind of like imagining your hands doing the procedure. And that's not only me. That's a technique that's been proven to like help in like Olympic athletes and other different, like even, or like like a ballerina or somebody that's doing something very technically challenging and stressful. So that visualization technique helps you kind of when you do it, and it's almost like reliving the moment. You're already there, and you know what comes next, and you just feel smoother in your movements, and that helps you control your reaction to the situation. That way you feel more in control.
Yeah, that's great. And one of the things that Dr. Bostock also shared with you, we were both swimmers. And I think one of the things that swimming at a certain level teaches you is about the counting, right? Like counting
Hmm.
your strokes and knowing the number and kind of meditating to that. And that's something, like you said, probably like this new era of surgeons, which I'm happy to say that I'm part of it, like you are. We have other tools to manage those things. Visualization is a big part in surgery now. Even like for me, it's like looking at other people doing the case. Like I go on YouTube or on a platforms, or the American College, and I look and see how people do that. I'm like, okay, that looks so smooth, and they probably curated that video, and that's the best video ever. But just for me, visualizing me doing those steps, and that's something that works in your life, as you visualizing yourself being successful in exam, being calm during the exam, and that type of behavior, I think, permeates your ability to connect with your present, and also the ability to successfully navigate all the stressors during that activity. Um,
Right.
I think that's probably something that I've learned also through the years. We have some questions about Adrian. You want to ask some other questions about the panel, and maybe get some of your own questions there.
Yeah, someone asked a question that it's actually was on my mind as well. What advice would you give to an IMG to stand out during a hands-on surgical rotation? This is the question I had too, because I feel like getting into surgery residency in the US, even as a US medical student, is so competitive. So, very curious to hear what advice you have for someone who's IMG, because kind of just, I think, an even bigger barrier.
Yeah, that's really tricky. I think it depends on the environment that you're going to be entering. I'll give you an example. So when I was as an intern at Brigham and Women's, so it was super competitive. It was a very interesting place to be an intern at. Is obviously the people that match there as in general as categoricals, prelims, whatever. They all of the people that I interacted with were super outstanding, very very intelligent, and it led a little bit at the beginning. I felt like a all this competition can be pretty cutthroat until you learn that most people just are gonna be good team players. And eventually I made great friends. But at the beginning, one thing that I did incorrectly was to try to be kind of a shark. I was extra aggressive in trying to get into the OR and getting cases and throwing every single stitch. And I would now I think about it, and I must have been so annoying, because to every single attending I run into, I was like, can I throw that stitch? Can I close that fascia? Can I do that? And they were like, dude, you're an intern. Like, why are you asking to like do the bowel anastomosis? Like, you don't even know, you know what I mean? So I was too aggressive, maybe too over eager. And I think there has to be balance in that as well. I think coming in as an IMG, based on that question, you're just really using the very valuable time to impress others, to try to get your foot in the door and get an opportunity. But I think there is such a thing as overdoing it. So I think having situational awareness of where you're at, and kind of understanding the opportunities that are given to you. And I think just being prepared and eager to help without being so overeager as I described, I think is super valuable. I think people recognize excitement and willingness to work and just being interested just naturally. I don't think you need to fake it. I think you just need to show up as who you are and be authentic. And that really goes a long way.
All right, I have another tricky one for you. What if you had not been a surgeon? What profession would you have chosen? Anything fun?
I don't know. My dad says that I would have been a journalist, but I don't know. Given that it takes me like 24 versions to get through a manuscript, I don't know if that's true. but I don't know. Maybe something in the arts. I think.
That's good. That's a surgeon is an artist too, so there's
Yeah,
something to it.
There it is. So, the art of medicine for sure.
We have some rapid fire questions are called for you. What is your favorite word?
My favorite word. Oh man, can I answer that now at the end? Let's go for the next one. Let me think
Okay.
about.
What is your favorite dish to eat?
My favorite dish. I like sushi the most.
Okay, how about your pet peeve in the OR?
Oh man, I hate it when people are having like a full-on like conversation behind me, like like a nurse walks in, starts talking to the nurses, and they're discussing how somebody is like getting a divorce, and they're like speaking at the top of like, and you're just trying to like, even though like I play music, I don't mind the noise, but when you're like in the OR and people are like just rambunctious, I hate that. And you're like, be respectful, please. I'm trying to work here.
Do you have a favorite instrument in the OR?
The robot. Is that a cop out?
Nice.
Yeah, but I love it. Yeah.
That's a good instrument. I'll
Yeah.
say. But somebody asked you, what is the thing that you miss the most about Mexico?
My family and friends for sure. Because at least in the food I miss a lot, but it's more the community that I miss the most.
Yeah, I would agree. One last thing about reflecting on your career, the path that you've taken, and how you've been able to successfully navigate all this difficult parts. What do you think was you already said, like, long hours and working hard, trying to prove yourself, but I'm going for a little bit deeper meaning of this, so bear with me. What would be the most challenging obstacle in the pursuit of this dream of becoming a surgeon ultimately in the US? And not talking about the hurdles of the boards, or navigating a residency, or trying to get into a categorical spot, and so forth. What's been the hardest thing on you, or the most challenging part of this journey?
I think the first part of my journey, like going through the training, I think understanding rejection and not taking it personal is very important, or has been critical to me. Even the process where I went from being a prelim to a categorical, that whole was really hard on my mind and and myself, just because I was like, well, if I wasn't given a categorical spot where I trained, it must have meant that I didn't do a good job. But you know what I mean? So dealing with that rejection, or like applying to residency and getting like, I applied to like 80 programs. I got 3 interviews. So all of those no's hurt you, and dealing with that constant rejection is very hard. And so not losing hope and trying to power through, I think is critical there. But if I fast forward to what things have been more difficult being an attending, I think it goes along kind of the same path as dealing with failure. Because as surgeons, we understand surgical complications are a part of life. The percentage has to come from somewhere, right? So sometimes bad things happen to good people and to good surgeons. But sometimes bad things just happen despite you taking all of the right approaches and trying to prevent everything from happening. And that failure, when things don't go well, and you lose a patient or you have a bad outcome. um, and I mean, I just have, I struggle less now, but you go through this process of being so hypercritical of yourself that can be very, it can affect your mindset and affect your ability to move on and help the next patient. So that's been challenging for me.
Yeah, I think that's something that we all surgeons deal with, and that's part of the process. And that's how, this article that talks as the surgeon, I think it's called the second casualty
Second
or something
victim.
like that. The second victim. Yeah, that's,
Yeah.
if you haven't read it, for all the panelists and all the people out there, it's a pretty insightful, paper that talks about this is a double hit theory, right? Like how, your complication, of course, has consequences, but that how it damages the surgeon's ability to cope, and some things are challenging, and that's what probably you're meaning to refer.
Yeah.
That's
I actually wrote a manuscript about that exact same conversation on how to deal with complications as a young faculty in cardiothoracic. And one of the things that I argued towards was in the power of vulnerability when it comes to your healing process, right? Because most of us, particularly in competitive specialties, would tend to isolate and not talk about the complication, not talk about what went wrong, and just try to like pretend it didn't happen. I'm strong, nothing's gonna go wrong again, and keep going. But then you don't get to process what happened, and you don't get to get better from it. You don't learn from it, and then it just builds up in you. So finding a space to be vulnerable, to share, to almost like what M&M is supposed to be, even though M&M is not fun, and you don't get to be vulnerable and share what happened. But the whole process is to be able to have some catharsis from the experience, and to find a community, or a surgeon group, or whomever it may be, your best friend or whatnot, and then help that and allow that camaraderie to help you. As a surgeon, it's hard to find someone that understands what you do and what you feel, like in your family. At least it is for me. Even though my wife is super supportive, she just doesn't understand what it feels to do what I do, and it's often only another surgeon that gets to understand that. So we got to protect each other.
Yeah.
I have one more question from the chat from a current general surgery resident who is wondering, are you happy with your choice with thoracic surgery? And specifically, do you ever look back and miss the abdomen or other aspects of general surgery?
Yeah, yeah. Maybe we can be. I think I'm being super philosophical tonight. I don't know why, but yes, I am super happy with my choice. I think of thoracic surgery as being kind of general surgery on steroids. I think we do everything from the chest to the belly, and even though I'm not in the pelvis, some thoracic surgeons are. Where I trained, we used to do hip disarticulation, sarcomas from the pelvis, all sorts of things. So I think your practice can look in different ways depending on where you practice. But from my standpoint, I get to do a lot of fine dissection and complex oncology in the chest, but I also do giant paraesophageal hernias and feeding access and esophagectomies. So I'm in the belly plenty. So I don't miss it because I feel like I still practice it. I don't know if I miss lap choles and lap bappies, maybe sometimes, but not usually. I do other fun things.
Yeah, that's something that I think it has evolved, and as we move towards more specialized medicine. I remember learning to do esophageectomies in my fellowship, and I was really at awe to see how the fellows were trained to do it and how I was trained to do it. I ended up not doing it anymore. I'm more focused on HPV and PSM. But one of the things that I was comes to mind is for the residents is looking what you said is looking to match to what your true interest, right? You said like, I knew I was not going to be a cardiac surgeon. So you wanted to do this emphasis on thoracic. And from the thoracic part, you wanted to be someone who was really good at dealing with malignancies, with lung cancer, with esophageal cancer. So I think that's a good strategy of being honest with like what you like, right? And what you don't mind, but you don't like as much. And
Yeah.
kind of going to that. So somebody says here, don't forget about your favorite word. We gave you a little bit. We give you a little bit of time for your favorite word, and it can be in Spanish. You can do that, but not bad words. That's somebody saying like.
Let's see. A word that I like. I don't know if it's true in Mexico, but I don't know somewhere else. But I say it to my kids all the time is the word chahuizle, which is like a monster in Mexico. So whenever the monster is gonna come out, is that ya te llegó el chahuizle, ya te cargó el chahuizle. I tell my kids that all the time, and I like saying that.
That's a fun word. That's an old school word. That's good.
An old school word.
We like it. We like. Yeah. Any other questions that you have from the panel? I think last question from the chat. How important do you think research is to apply to a competitive specialty? I think you touched a little bit about, but you can give us a little summary of how important research is for a competitive specialty or surgery.
I mean, I think it's going to open doors for you. I think it's certainly important, but I don't think it needs to be the end all be all. I think you're telling a compelling story about who you are and why you belong to that new specialty or the specialty of your choice. I think is more important. So if you have a few papers, but you've done them with pride and done good work and can talk about them with passion and why you did it and why you thought that was interesting, I think that's going to speak wonders. I mean, I'm not saying that somebody with like 15 publications going into fellowship is just not going to attract attention. Of course they are, but I don't think it's the magic bullet.
Wonderful. I think, do we have any other questions? Adrian, as a future thoracic surgeon, do you have any other questions for Dr. Bostock?
No, yeah, thank you for everything. It was great to meet you, and good to hear your story. I think it's really unique, and I just feel like being a CT surgeon is already so hard, and then doing it with those extra barriers of coming from Mexico is great to hear.
Yeah, and there is something that like we don't talk about it enough, but given that there's so few Latino surgeons in the country, it can feel not only isolating, but sometimes you feel like everybody is kind of watching you. So doing these high risk, high level things tends to be even more stressful for people like us. So we always have to understand that and then just give each other a pat on the back.
Yeah, Dr. Bostock, I cannot thank you enough for this very candid conversation. I think it was not philosophical. I really felt it was it's very deep in a way that I think we have to be honest about what this profession is, right? We're owe it to ourselves and to the future generations, and this forum, this platform allows us to be honest and but also to inspire other people. And I think you've done just that. I really, really appreciate your time, your thoughtfulness, your ability to answer tough questions like El Chahuistle. That was a tough one. So thank you for answering that. And I wanna thank all the team that make this possible. Please get involved with LSS. It's a great way of looking into what it's being a surgeon, a Latin surgeon in this country. How, like Dr. Bostock said, there's a need for us out there. You are the generation that is going to bring this to the smaller numbers to big numbers. And we thank you, Dr. Bostock. I thank you, everyone, to the team. Thank you for you guys. You made this happen, for your ability to help us through this and navigate the hurdles of technology. And you see a couple of people on the screen here, but there's Andrea, Adrian today, Christian, Aldo, Stalin, Alejandra, to all the sponsors. Thank you, everyone, and I hope you have a good night and you'll learn as much as I learned from life, from thoracic surgeon, and from being a Latino surgeon in this country. Thank you, everyone, and hope you have a good night.
Thank you, everybody. Thanks for having me. This was great.